Welcome, everybody. This is Feeling Fit with FSHD. We meet every other Thursday, second and fourth Thursdays of the month at noon Eastern time, and you do the time zone adjustment. And today, we're really pleased and honored to have Andrea Jaworek to present to us about FSHD and aquatics. Andrea is a physical therapist who has worked a great deal with neuromuscular patients, both as a clinician and as a researcher. I knew her actually from Kennedy Krieger Institute, where she gave a wonderful presentation a few years ago at our 360 meeting there. And she's now at Ohio State. And so those of you who live in that area or go to the Columbus, you should know about Andrea because she's a wonderful resource for you there. And somewhere along the way in one of our conversations, she mentioned how she's very passionate about aquatic exercise. And we've heard so much about how beneficial that is and for people with FSHD. And I thought, well, this is our chance to really have a talk about it. So I'm so pleased you're here today. And she's going to give a presentation, and then I hope there'll be a lot of Q&A afterwards. This is really for conversation and answering your questions. And I also apologize ahead of time that I have to cut out early from the meeting, so I'm going to disappear shortly, but I wanted to be here and make sure I welcome you all and get the day going. So Andrea, it's all yours.
Thank you. Thank you all for having me. And I'm excited because, as June said, I'm really passionate about this topic. A little bit more about me. I've been a PT for 14 years, and then I started aquatic therapy in 2017. And so I've been at OSU since 2021. And funny story, when I started doing aquatics here, my son was about like 4 years old, and we had moved into a new house, and I was in the pool a lot. And fun fact, we also have a Buckeye Paws program here. So we have therapy dogs walking around, which I absolutely love and adore. And so I would come home smelling like chlorine all the time and have dog hair all over me. So when we met our new neighbors, they asked, oh, what do you do for a living? And my son told them, my mommy plays in the pool and pets dogs all day. So that was the time where I'm like, oh, I think I need to actually have a conversation with my son about what my real job is, although he's not far from the truth either. So we're going to go into a little bit about some different things with FSHD and aquatics. Let me minimize this here. Okay, this was working, and now my screen is not moving forward. There we go. Okay. So what we'll cover today, what are the benefits of aquatic exercise, what the research shows, what are the medical precautions or contraindications to getting into the pool and exercising, the exercise considerations for aquatic exercise, how to get started, what are some of the recommended pieces of equipment that you can use in the pool, and what are some recommended exercises or activities to do in the pool. So the benefits of getting in the water. So it can improve your quality of life and your independence. It may slow the rate of weakness, so that progression of weakness. It improves the ability to take part in other aquatic exercise, and it improves the safety with moving and being active. It provides support and lessens pressure on the joints. It helps lower pain levels, especially if you can find a warm water pool like ours here at OSU is 91 to 94 degrees. So it feels really, really good. And if you're having pain anywhere in your body, like your muscles and your joints, it can really help reduce pain levels. It can improve strength and range of motion. So as you know, when you have less pressure on your joints and the buoyancy of the water, it can help you move through a further range of motion. It can help improve the way you breathe, and it can help your endurance by keeping your heart and lungs healthy. And my point at the top where it says it can help you take part in other aquatic exercise, by seeing a therapist or learning from one of us on how to do different exercises, we often find out that those people can then move on to doing a different aquatic class at the YMCA or their local wellness center. because then once they can go do that class, they can know how to like modify the exercises themselves to be like, oh, I can't do that one that they're demonstrating, but I'm going to modify it specific to my needs. Okay, so what the research shows, these are not an FSHD diagnosis, but they're different neuromuscular diagnoses. So I'm not going to go over all of these, but there are some common trends. So for like Duchenne, positive effects in motor function, you have breathing improvements, you have quality of life, like wheelchair mobility. For spinal muscular atrophy, you have more gross motor function improvements as known in the GMFM, the Peabody, the Hammersmith. Again, you can see the pulmonary function or breathing improvements. There's also some gait speed and stride length improvements. And again, you can see quality of life. Charcot-Marie tooth, you can see also some gait parameters. So the 6-minute walk test improvement, as well as gait speed again. And you can see quality of life there again. So a lot of these you're going to see quality of life, which is what I really love. Peripheral neuropathy, you can see there have some gait, so some balance ones improvements. Limb girdle muscular dystrophy, upper and lower extremity strength improvements, again, breathing improvements, quality of life again, Guillain-Barré, some more walking parameter improvements, and also quality of life. Congenital muscular dystrophy, you can see some with, again, motor function, as well as like seated reaching, so seated balance and post polio, upper extremity strength, and pain levels. I really like the pain level one that was thrown in there as well. To this day, there's been no aquatic research on individuals with FSHD, but as we know through like neuromuscular research, we can often relate the interventions and like peer-reviewed research articles that are done in other neuromuscular diseases to other neuromuscular diseases. So we can kind of combine and look at the similarities and relate that to FSHD. Okay, so the medical precautions getting in the pool, these are not absolute no-nos. It's just if you have any of these situations, maybe talk to your doctor. For instance, if you have like unstable blood pressure, we don't want you getting in the pool feeling lightheaded and dizzy and possibly like passing out. If you have a seizure disorder, we want to make sure that is well controlled, that you wouldn't possibly have a seizure into the pool. So we obviously want to take a look at all of these things and make sure these conditions are well controlled where you'll be okay being treated in the pool. These are absolute medical contraindications that we will not get you in the pool if you have any of these going on, like active vomiting, open wounds, any infections going on, if you're having like diarrhea or loose watery stool. And we always say too, here at OSU in my last job, you always want to get medical clearance from your physician before starting an aquatic program. This is just to make sure that everything medically going on with you is okay to get in the pool, specifically if you have a cardiac issue. So anytime that you may have a heart issue, we always want to get like clearance if it's more serious, like from your cardiologist. Okay, so exercise considerations. It is ideal for you to have a warm up and cool down for aquatic therapy. So it helps reduce your risk of injury and allows you to slowly increase your intensity. So the current evidence utilizes a variety of these warm up and cool down exercises. It could be 5 to 10 minutes of walking. It could be upper and lower body stretching and like breathing exercises. So some of the breathing ones that's utilized in research could be like bubble blowing. It could be like bobbing your head up and down, holding, breath stacking. So like slowly going down in the water, holding your breath for 1 moment, taking a deeper breath, going down under the water. So different breathing exercises like that. And then current research supports the use of low to moderate intensity strength and aerobic training for individuals with FSHD. It's shown to be safe and effective. This still applies to the aquatic environment. And I know what some of you are thinking out there, that you've all seen a few research articles showing that high intensity has now been proven to be safe and effective. The one thing I will say about that is those research interventions were looked at like mainly in the quadricep muscles that were like 5 out of 5 strength. Those had not been affected by the disease yet. And those are patients that were ambulatory, so were able to walk we currently don't know how high intensity exercise affects muscles that have been affected by the disease yet. So when you're in the aquatic environment, you're using multiple muscle groups at a time. So we're still recommending low to moderate intensity for individuals with FSHD. We just don't know how high intensity affects the muscle groups that have been affected by the disease yet. Okay, so more considerations. We utilize the talk test here at OSU. So that means if you're doing an exercise, we want you to be able to maintain having a conversation while you exercise. So it can be like a simple conversation. It doesn't mean you have to be able to talk paragraphs, but that's the goal of being able to keep the low to moderate intensity realm. You can also use the board rating of perceived exertion scale. So the RPE scale, we use the 6 to 21 here at OSU. So if you go higher than like 13 to 14 out of the 20 scale, it may mean that you're entering the high intensity zone. So it may mean to like scale back down a little bit. So things to look out for. We don't want to have muscle soreness that lasts longer than 24 hours. We don't want pain with exercise or extreme fatigue or muscle cramping. So if you do something that when you get out of the pool, you are exhausted the rest of the day, you have to nap, you can't do your regular like activities of daily living, then you've gone too far. It doesn't mean you did the wrong exercise. It just maybe means that you did too much of it. So try to scale it back down the next time. So for the first few aquatic sessions, you want to take more frequent rest breaks than you even think you need to. You need to decrease your session duration. So even start smaller. If you think, oh, I think I can go for 45 minutes, do 20. And you want to assess how you feel the rest of the day and in the following days. Why we do this, we have a lot of patients get in the pool, it's nice and warm, they feel wonderful, and we're like, oh, we should take a rest break, and they're like, no, I don't think I need to. You really need to, because what happens is people get out of the pool and their body is talking to them afterwards. They just really overdo it. So I force my patients to like really take a lot of rest breaks throughout, and then we just slowly increase after that with longer duration and with taking less frequent rest breaks as we go along. Okay, so depth of the water level matters. This helps us determine like how to progress or regress an exercise program. The deeper water has more greater off weighting due to the buoyancy of the water. We have this chart over here that shows the different like body mass that's unloaded during certain depths. The further into the deep water you are, you also have the more likelihood to perform like a greater range of motion. In contrast, when you're deeper, it also has the potential to offer increased levels of resistance, and this is due to the viscosity of the water also. Okay, so you're probably thinking, how do I get started? There's two different routes you can go. If you're looking for actual aquatic physical therapy or like outpatient physical therapy, you can search online for either aquatic physical therapy or outpatient physical therapy and look at the services that they offer. Sometimes aquatic physical therapy isn't always the best search tool. So a lot of times we have to search outpatient physical therapy services, and you find a clinic and you look at the services they offer within there, because that helps often. And then you can call the clinic and see what it entails. If you are just looking to do something on your own and get started, search online for like aquatic centers or wellness centers and look at like your local YMCA or gyms, etc. Oftentimes those have a pool, or ask your local PT. A lot of times your local PT place knows of what aquatic centers are around, and often what kinds have like the best equipment for patients to go to. However, if you're in the Columbus area, so near me, we here at our clinic have a list of 31 aquatic centers that we can provide to you. So it includes phone number, location, price, if a membership is required, if they take silver sneakers, and the pool temps of all of them, because our patients really like warm water. So see if your local PT has a list like that, because they very well possibly could. So it saves you doing like a lot of the work on your own. Okay, so what you want to ask your clinic, do they have a lift chair? I have a picture of this on the next slide. These are for those patients that are unable to walk, they need help getting into the pool. The chair starts on the side, it helps lower them into the pool. Stairs, you ideally want to avoid ladders. Ladders are very hard to get in and out of. So even if you are able to walk, ladders are still really hard to use. So see if they have stairs to get in and out of the pool. Some have stairs in the deep end, some have stairs in the shallow end. So you can even ask that question. See if they have staff to be able to help you transfer or help you get in the water. Some do. We have a couple centers around OSU that do have staff to be able to help you if you need to. Otherwise, you need to bring like a family member or friend with you. And do they have something you can sit on when you're in the pool for rest breaks? Do they have a water bench? Do they have a pool chair? Other times you need to like sit on a pool noodle or like the edge of the stairs. And can you bring your own equipment? I often have patients that, we have different pieces of equipment here at OSU, from like ones that I've learned in courses, and we'll be using it. And they're like, I've never seen this before. They don't have this at my local YMCA. So they will, purchase it, and then they'll call their local center and ask if they can bring it in. And then how warm is the pool? It's another thing to ask. Not everyone likes going to even like a mid-80s pool, especially after they've been in ours. So they'll try to find a place that has a warm pool. Okay, so here is equipment that is helpful to get into the pool or for rest breaks. The top left, not often I find that a lot of people have seen. So it's a pool bench. So it is made of PVC pipes. We had them at my last job at Kennedy Krieger, and they were amazing. So you can lower them into the pool, and then the PVC pipes fill up with water, and you can take rest breaks there, which is awesome. And then to pull them out, the water just leaks from them, and then you can pull them out of the pool. They can also be homemade, so which is kind of cool. So if you have someone handy in your family, they can make them. I've had patients that have like a family member has a pool, or they have a pool in their backyard. So if you are lucky enough to have that, that is something that you could possibly do. The lift chair is on the top right. So this is something that you will really want to check if your center has. So that way you have a means of getting in and out of the pool, and then you can see if anyone can help you get in and out. Bottom left is a pool chair, same idea, made of PVC pipes. So you're just lifting that in and out of the pool, and you can utilize it for rest breaks also. Stairs, I put that picture on here because it's good for rest breaks, it's good for entering and exiting the pool if you can, but that way you don't have to use the ladders. Okay, so equipment that is helpful for exercises. These are a lot of the main ones I use. You have ankle floats, you have dumbbells. There are thin and thick dumbbells. So like double ones, single ones, adjustable ankle weights are amazing because you don't have to buy a bunch of different ankle weights. They have little inserts. You can decide how much weight you want to use for different exercises. Neck floats, I use them all the time. Resistance gloves, so adding more resistance through the water as you do exercises, and also water paddles. Some more of the aqua jogger. I do a lot of exercises in the deep end. The kickboard, there's thick noodles and there's thin noodles. I use the different varieties a lot for different exercises. A lot of people don't realize there's two different sizes. A water walker also. So I have patients that are unable to walk on land that are able to walk in the water, either with or without a water walker. And there's different varieties of these. So some are like this that is pictured, and others are there holding on to these like little posts in the like little handles in front. So I have some patients that like that a little bit better. The Wonder Board is absolutely amazing. I learned this at an aquatic course, and it is different than a kickboard because it has a little V in it, and you're sitting on it and doing different like core strengthening or sitting balance exercises. And I have pictures of it later. A beach ball is always a good one. There's mini ones and there's big ones. If you are one of those patients that still have some decent arm range of motion, then we do a lot of like balance activities utilizing that. Okay, so you're probably wondering, what can I do? How do I, start off? And so I am applying this to a lot of different functional levels right now. So what I did throughout all of these are kind of organized: warm up, cool down, core strengthening, aerobic, upper extremity strengthening. So arm strengthening, leg strengthening, and balance. As we go through all these, I'm kind of going over each section briefly to give you a good idea, there's a variety of exercises in here. I obviously can't go over all of them in like 20 more minutes. So anytime, so for those patients that are able to walk still, there's a bunch in here for you. And those patients that are unable to walk, I have a bunch in here also. There's exercises that also double as both because as you can see here, I wrote pictures like or wrote little things and put a picture by it. Someone seated and says can also do seated. So if you look at the picture, you can just imagine if you're seated, you can also do the same exercise. We had an artist at OSU that drew a lot of these pictures for us. We just don't have everyone drawn yet. So we did like a patient handout and we were lucky enough to get a lot of these drawn for us. So the first one for like warm up and cool down, you can walk forwards just to get your heart pumping and your overall muscles going. And then you have a shoulder internal rotation stretch. So you're stretching like this, stretching your pec muscles. Again, you can also do this in the seated position. Your trunk rotation stretch. I like the bottom one the best, and you can also do this seated. It's amazing what you can actually do with a pool noodle. You can accomplish a lot of exercises with just one pool noodle. The lateral rotation stretch. I know some of you are looking at this like, well, I can't raise my arms up that far, although some of you still can. So this is like a great exercise that you can still do if you can. You also don't have to raise your arms up very far. They can stay down here and you can still get a good trunk stretch on the side. You have your stretching your hip muscles in the front, and I have another one later on too that I can show you. You have your inner and outer leg muscles that you can stretch. And these bottom next two are my absolute favorites because I love stretching with a noodle because basically the noodle is doing all the work for you. I just also put the top two pictures for a hamstring and quad stretch because the bottom two, you often, patients need help getting the noodle underneath their leg. So sometimes that takes a partner like being with you. So the bottom one, the hamstring stretch is, and you can also do these two seated. You're gonna put the noodle underneath like your lower leg, and because of the buoyancy of the water and the buoyancy of the noodle, it just lifts up and you can stretch your hamstring. It is a wonderful stretch. My patients always love it. And so the next one, the quad stretch, also doubles as like a hip flexor stretch. So the noodle is going to lift up your leg. And you can also do this seated. If you're at like the edge of a bench, you can bring that side leg around the edge of the bench and the noodle can stretch your leg also. But that one's great too. The further you move your leg back, you get more of that, just pure hip flexor. Calf stretch. You can also sit down, stretch your leg in front of you, put a noodle around the ball of your foot and pull the noodle back, and that will give you a good calf stretch as well in the pool. And it just helps because if you're in the warm water pool, your muscles are nice and warmed out and you get a better stretch. Okay, so let's switch to upper body strengthening and range of motion. So I want to preface all of these can be done in the seated position, and you don't have to go through the full range of motion that you're seeing here on these pictures. So if you can't move your arms all the way up like they're showing, you just move it to whatever you can that's pain-free, and that's all you need to go. Sometimes the water helps take you a little bit further, which is nice too. So you can move your arms up out to the side and then back down. The nice thing about the water is you're getting resistance in both directions, so you're actually working multiple muscle groups in one exercise. You're going to come out to the side and then you're going to come back in, and then you're going to go up in front of you, and then you're gonna go back behind you. So again, they can all be done in seated. What I also want to say is if any of that is too easy, just doing with regular resistance of the water, you can add the water paddles, you can add the resistance gloves, you can add the dumbbells. So don't forget about that as well. So elbows, you can come up like this, you can come down like that. One thing I want to say is if your biceps have trouble, and you can only use what we call like the brachioradialis, you can do it in the neutral position. So if you can't totally open up your hand, don't forget you can just do this as well. You can also take dumbbells or whatever piece of equipment you want, and you can push down into the water to work on those triceps also. The next one is one of my favorites. It's arm circles. Again, you don't have to go this high. You can keep it low if that's, all the range of motion that you have to work with. You can go forwards, you can go backwards, you can do figure eights, both directions, shoulder rows. And all these you can do seated as well. Shoulder rows, you can pull straight back. You can add the water paddles. You can add dumbbells, whatever you would like. Okay, this is one of my favorite exercises for individuals with FSHD, so I gave it its own slide. This is the best picture that I have of this. We haven't gotten the artist to draw us this yet. So you always want an additional piece of flotation like underneath your lower trunk or your hips. What you are doing, if you think of what a snow angel would look like in the snow, you're doing this in the water. So this is really good for your shoulders. You're going to be moving your hands up towards your ears, so up towards your head. And the nice thing is, which you can't accomplish on land, is you are getting resistance in both directions. So up towards your head and then back towards your body, you're getting resistance on the way down also. So what I have people do is have them go as far as they can on their own, pain-free. If I notice that they're still loose in their shoulder and they have more range of motion left that they just can't get to because of weakness, then I will lead them the rest of the way so they get a nice stretch. And then have them try to come back down. That way their shoulders stays nice and loose. We get a little bit of a stretch out of it in the warm water, which feels good. After they do that, they can also work on bringing their legs in and out to work on their inner and outer thighs. You technically can do this all together, arms and legs at once, but I find by separating it out a little bit, then they get like a little bit better form and technique. And then one exercise I want to talk about really quickly that I do not have a picture of, and it was impossible to find, that I actually learned at my last job was, and it goes with this picture, which is why I'm talking about it. If you actually stand in between like the patient's legs, like right around their knees, you can kind of hold the patient at their legs, at their thighs, and you are rotating them and you're twisting them around, coming this way. It is great. The patients love it. They get a nice trunk rotation. It feels good on their spines. It feels good on their hip. So it is just wonderful. So I wanted to throw that in there as well. I cannot find a picture of it anywhere, but it's just really great, and our patients love it. Okay, so lower body strengthening and range of motion. You're gonna kick your leg forward, out to the side and back, and obviously use the wall, use a pool noodle, anything you need to support yourself. So knee extension, you can also do this sitting. You're gonna start with your knee bent and you're gonna straighten it out. You can also add ankle weights. You can wrap a pool noodle around your ankle that's gonna add more resistance to kick it out if you don't have the ankle weights. So knee flexion, you're going to start with your leg all the way out straight and you're going to bend it back towards you. Again, add the pool noodle around your leg by tying it around, or you add ankle weights if you need to. You have your heel raises, you have your toe raises, you have squats. I do squats a lot with my patients. And you can hold on to support. I usually do the bottom picture with both hands holding on. Okay. A little bit of more lower body strengthening. So you have lunges you can do. You have the forward and lateral step ups if you have the stairs to get into the pool. You have the sit to stand. So I actually will still practice this with my patients. Even some that are unable to walk, as you can do like partial ones or even assist from me. So even if like a transfer is hard to do on land, it's going to be a lot easier in the pool because of the buoyancy, and depends how high the object is that we're standing up from. So a lot of times I will help them with a sit to stand, or a lot of times it's a lot easier, just they can do it partially on their own. They might be able to stand in the pool but not walk, or they just need my help standing a little bit. If the sit to stands are easy, you can do what they're doing, have a resistance ball. If you don't have a resistance ball, add an ankle weight in your hand, anything that's a little bit heavier that's going to make the task a little bit harder. Hamstring curl. Here's an example and a picture of what I meant by wrapping that noodle around you, just to make the task a little bit harder if you don't have ankle weights. And you can also do this in the seated position. Noodle push downs is a fun one to do. So you're starting with your hip and knee at 90 degrees and you're pushing the noodle all the way, touching the bottom of the floor, and then slowly raising it back up. It works a little bit on balance and just control in the strength of your leg. Okay, hip circles. You can do this for those patients that are unable to stand. You can do this in the deep end. So putting like a noodle around your trunk and underneath your arms, or you can even put an aqua jogger on your waist. You can do this. So forward and backward circles. Scissor kicks are one of my favorite exercises. So that's what I mean about putting the noodle around your trunk and underneath your arms. So you're just moving your legs back and forth like this, front and back. People love exercise. It feels good on your legs. So this one is the only picture that I have, but I do not recommend putting your arms back like that on the pool wall. I actually recommend doing it as the middle picture with in the deep end with the noodle around underneath your arms and around your trunk. So just after you do the scissor kicks, just go ahead and go out and in with your legs. That way, it would not be good on individuals with FSHD to have your arms out like that. It would not feel good. So I just do them in the deep end. Okay, so these are one of my favorites. I learned this at an aquatic course and my patients have fun with it. So if you're sitting on a noodle, and if my patients have a really hard time with that, I am behind them, or even in front of them, kind of like wrapped around or to the side. So you can also sit on two noodles if you want to, if you need a little bit extra support. So first, you're just going to sit and try to maintain your balance on that noodle. Once you've accomplished that, you're going to do like alternating leg kicks. That's going to throw your center of gravity off. It's going to make it a little bit harder for you. Then you're going to try seated marches. So basically, all of these exercises, we are trying to challenge your core and make your core work harder. So then the next one is like cross-body punches. So you're doing this. You can even add in like some Tai Chi movements. So when you have your arms out in front of you, you're seated on the noodle and you're doing this. Okay, trying to do this. It's really going to challenge your core because your body's going to start doing this. The thing that's really cool, if you have access to a Wonder board or you want to purchase it, it's the thing that I was mentioning on the other slide is pictured right there. This is a lot harder than sitting on a noodle. Sometimes the first few sessions, my patients are just trying to sit and balance. They're not even adding in the progression at all. And my patients, the ones that don't care about like falling in the pool or getting their hair wet, they even have a lot more fun with this because I can stabilize them and like I'll go to like putting my fingertips on and then trying to take my hands off it for a couple seconds. And sometimes they're like, no, I just want to try it myself. And so we'll let go and like they laugh hysterically if they like fall over into the water. So it all depends on what my patients want, how much they, will want me to help stabilize them. So sometimes after a few sessions, then they're like, okay, I have my balance. And then we start working on the progression of that exercise. So all of these shown here, you can do on the Wonder board. And that's one of my favorite ones to work on core strength, especially with individuals with FSHD, because we know that core weakness is an issue. And it's a fun one to do as well. Okay. So a little bit more core strengthening. So crunches, as you probably know, we don't recommend just straight up straight up like crunches or sit-ups on land. So what's really cool about the water is we can do assisted sit-ups in the water, assisted crunches. So what you're gonna do is, I don't like this picture either, but you're gonna put a noodle underneath your knees and a noodle wrapped around, like you saw that other lady in the picture, around your trunk and underneath your armpits. And you're going to bring your knees up to your chest. So that's your goal. And it's like kind of like folding yourself almost. So it's an assisted crunch. They're fun. People usually think it feels good and they're working out their abdominal muscles. Tall kneeling is another one. This picture is showing someone getting into the position of tall kneeling. So they're going into that full upright position. So you can do it in the shallow end or the deep end. And you can even try this if you're unable to stand, you can have someone help you get into the position. So you're ideally working on that core strength. You're on your knees, you're fully upright, and you're going to be really engaging those abdominals. Forward plank. You are going to be, as in the picture is shown. You can also, if this is too hard, you can do it on your knees from like the pool bench or the stairs, whatever you need to do. You can also, if it's too hard to put your arms out all the way straight, you can do it on your forearms. So there's some adaptations. Same with the lateral plank. You can do it on forearms. You can do it from your knees, and you do not need your arm raised in the air like that. I usually don't have my patients do that. Trunk rotation, you can also do seated. You are going to, she has a lot of fancy equipment on. You can just take a dumbbell or a resistance ball or anything that you want to, even those water paddles, and rotate like that. This is one of my favorites, so I kind of have like screenshots of the progression. So you are tucking your legs and you're in the deep end, you're tucking your legs in and you're rolling back, and then you're kicking your legs almost straight, and then you're repeating it again. This is really good for the core, it's good for the trunk extensors, and it's good for the hip extensors. So it feels like really good, especially for individuals with FSHD. Okay, so on to aerobic. You have standing marches. I usually have my patients do like 30 seconds, take a rest break, and then repeat that like 2 more times. And then over time, we're slowly like increasing that. You can also do this seated. We have sideways walking. We have backwards walking. We have forward walking with arm swings. So the faster you go, you can use those resistive gloves. And then you are also getting your heart rate up. Bicycles is some of the most like underrated exercises. They're fun. People like them. It gets that heart rate up. I usually put my people in the deep end to do it. I have them a little bit more reclined than that picture shows. And I have the noodle underneath the trunk. Sometimes they'll want another one at the hip. So it just depends. Underwater jogging is amazing. And again, like these last 3 people can do that aren't walking also. So the underwater jogging, put that aqua jogger on. You can even do that with a couple pool noodles underneath you too. And then the flutter kick, get that kickboard out and just work on that kicking. Okay, so balance exercises. The footprints on the right are different patterns that you can practice keeping your balance. You can try holding onto a pool noodle, holding onto the wall, slowly going to no support. And I learned this in a course. If you can have someone add turbulence to you from the water, it's a really great way to make the exercise harder. It kind of also helps you prepare that, like, if you're in a grocery store walking around and someone bumps into you, it works on that reactive balance. So the best way to do that, if you have access to a kickboard, have them use the kickboard to actually throw the water into you and add that turbulence. So you have walking with head turns up and down, left and right, walking heel to toe like you're on a tightrope or an imaginary line. Again, have someone add the turbulence to you. This will make this a lot harder. So some of my favorite ones I also learned at an aquatic course. You're going to stand holding onto a pool noodle. Your back is facing the pool wall. You're going to take one leg and you are going to touch the pool wall slowly, one at a time. You do not have to go as high as the lady is showing in the picture. So you're gently touching the pool wall with your foot, coming back down, then alternating and touching the other leg to the pool wall and back down. This works a lot on balance. It's a little bit more of a slow motion. It gets your hip extensors involved. And the noodle is kind of going like this because your body is working really hard to do the task, which I liked. The middle 2 pictures are always challenging. Sometimes it's challenging for me as well. So you're going to practice just that static standing on a noodle. And you always want to use a thin noodle for this one because the thick noodle will just pop right up. It's almost impossible. So a thin noodle for sure. The one on the left is much harder to do. So once you get your balance, then you're going to try walking forward and back, and you're going to try walking sideways. Obviously, it gets way harder when you're at the end of each noodle. One of the last ones is my favorite. You're going to start walking. You're going to have a friend call out go and then stop. And you're not going to know when they say stop. So, and the goal is when they say stop, you're going to stop on a dime and you're going to try not to take any extra steps when they say stop. So this is working on that reactive balance as well. What happens is the water catches up to you and tries to push you over, which is going to help you when you're on land. What you want to try also is trying to go at different speeds. So you can try it at a slow speed, try to speed it up, and do that same thing. Okay. One of the last two with ankle floats on, you have an ankle float on one leg. So I learned this on a course as well. I call that, for ease of understanding, whatever float the leg is on, I call that your blue leg. So if you picture an imaginary log or like a hurdle in front of you, you're going to take your blue leg, and you're going to pick it up, step over, and tap your foot over in front of the log, and you're going to bring it back to the starting position. You're going to do that about 10 times, and then you're going to try to keep your blue leg down and planted, and you're going to step over with your other leg and back 10 times. And then you're going to switch the float and put it on the other leg, and then you're going to do the same sequence all over again. What is hard about this is that your leg with the blue float on always wants to pop up, and you're using extra muscles to try to keep it down. And so it becomes a balance and a strengthening exercise. Most of my patients like to hold on to the wall when they first start it, and then they try to go down to a fingertip, and then they try to take their hands off, and they usually have a lot of fun with it. You often need help getting on the blue float because your leg's high up and you have to have someone else put it on you. Then you're like really pushing it down in the water to get it on. So it's a different way. Everyone thinks an ankle float is used to like float your leg at the top of the water. So it's a different way to use them, which is cool. Monster walks. So obviously no Theraman is the only picture that I can find, but because you're moving at a diagonal way through the water, you can do this forwards and backwards. The water catches up to you every time and tries to push you over forwards and sideways. So it's a good reactive balance one as well. Okay, so for those individuals that are unable to walk, I know I just did a few in balance that were all standing. So you are going to want to focus on those, like there's some of those seated core ones that were in the core like strengthening section that are also double as seated balance ones. So some of those ones on the noodle, you can do on the Wonder Board. So even on the bench, if like the pool noodle or the Wonder Board is too hard for you, you can sit on the pool bench. Like, so anything reaching outside your base of support, anything like that is going to be like a seated balance exercise for you. Okay, so ways to make exercises easier or harder. So easier means like you can decrease your repetitions, decrease your duration, perform using arm support, and that's going to vary if you feel like you need the pool wall, the noodle, or dumbbells. So using a flotation device makes things easier. And depending on the exercise, you can go into deeper or shallower water. There is no hard, fast rule on this. It just depends on the exercise. So to make things harder, you can increase your repetitions, increase your duration, perform without arm support, perform with ankle weights, dumbbells, resistance gloves, etc. Depending on the exercise, go into deeper or shallower water, increase your speed, or add perturbations in the water. Okay, and takeaways. So get clearance from your doctor before beginning, find a pool that can accommodate your specific needs, take a friend or family member for help if needed. Start slow and slowly increase in duration or intensity. And remember, you can do a lot with just a pool noodle. So you don't have to like find a place that has all these fancy pieces of equipment, or if you have a different access to a pool, you don't have to go purchase all these fancy pieces of equipment. There's tons of things you can do with a pool noodle. And then don't forget to drink water. Here are my references. And I am happy to answer any questions now. And also here's my contact information, so my phone number and my email as well. So I'm going to stop sharing this, and then hopefully anyone can ask me questions now. Yeah, go ahead. I think you're on mute. Oh, yeah.
Thank you very much.
Yeah.
These aquatics are fantastic because I knew a few, but this is really much broader. So
Yeah.
thank you so much.
Yeah, no problem. Yeah, for sure. And I think someone just said, can we get copies of the slides? And yes, I definitely can. I can ask June if she would rather send that out or if people just want to send it to me individually to request and I can send them out. It doesn't matter to me either way.
I
So
think it's going to be recorded so that they can always see it on the YouTube
true.
channel with the FSH Society.
Yeah, true. Yes, definitely.
Where are you, by the way?
Columbus, Ohio, at
Okay.
Ohio State University. Yes. This one said, how many days a week should you? Let me go back. How many days a week should be our ideal number of days to work out? Sure. So it depends if you're doing another exercise program besides aquatics. So, if let's say you're just doing aquatics and you're not doing any other type of exercise program at all, you could do like 3 times a week, maybe something like that. 4, maybe, that might be pushing it. But if you're also doing, going to the gym and doing like a program at home that includes like other resistance or strength training, and you're already doing that 3 times a week, you can maybe do aquatics another 1 time a week, or if you're doing like aerobic and strength training program twice a week, then you can maybe add aquatics in another 2 times per week. A lot of the research out there has shown benefits to an aquatic program 2 times per week when they tested like aquatic physical therapy for neuromuscular disorders. So that's like the general rule of thumb when they were doing all of the like peer-reviewed research and scoping articles for like the last so many years, is the 2 times a week was shown to be like the most beneficial. Trying to see.
I'm not sure that people know that they can unmute and ask you questions directly,
Yeah,
that you don't have to read it from the chat.
yeah,
So everybody here is muted, but if you go to the lower left, you can unmute or
yeah.
did you just unmute everybody?
No, I haven't unmuted anyone.
Oh,
I don't think I
no,
have
they can unmute.
anyone that can't unmute themselves.
Hey, Andrea, I have
Oh,
one.
yeah, sure. Hi.
Hi. Thanks for the presentation. It was great.
Yeah, of course.
So my question is, since pretty much or like most of the uh, dystrophy diseases are progressive, at
Hmm.
what stage would you say somebody is ready to transition into aquatic only exercises or majority aquatic exercises?
Yeah, so honestly, even if someone like isn't even feeling effects or any like, anything due to FSHD yet, I get them into aquatics like right away. If they would like to. Because I always think it's good to start it. Because he will feel really good and it's a good way to like maintain that muscle strength, function, and endurance over time. It doesn't mean you have to do it, all year long. But it's a good idea to get like a base. And then it doesn't mean you have to transition to it like all the time as you start to progress. If that was kind of like more of your question. I think as people progress and start to get weaker, it's a really good like utilization versus land because people can obviously achieve a lot more in aquatics and they just feel better overall doing aquatics. But I never think it's something like we have to switch all of their exercise program over to aquatics. I still think there's been a benefit to land, if that makes sense. We have a lot of people that even alternate between land and aquatics. So every other week they'll switch, or they'll do like a bout of 3 months of aquatics, and then they'll take a little break, and then they'll do land, take a little break, and then come back to aquatics. And people definitely like have their preferences. So I think you can definitely start doing aquatics early on, even if you don't have that many impairments. But I think as it kind of goes on, I guess I would never say like, oh, you definitely would only benefit from aquatics now. I might say I think you'll get more benefit from them. But we definitely want people to have a home program on land also. So when we're doing aquatic therapy, they may just see us once a week and we'll say, once a week in aquatics isn't enough. We're still going to give you this home program on land as well to do at home.
Okay.
Does that answer your question? Kind of.
Yeah, absolutely. Appreciate
Okay.
it.
Okay.
I have a follow-up question.
Yeah.
So, I'm sure everybody here is from all over the country, maybe all over the world.
Yeah.
So if, since this is a rare, most of these are rare diseases, it's hard to find a local group or a local training facility which specializes in, so how would you recommend people go about? So, say, do we get, uh, we go to a physical therapist who shows us the exercises, and then we do it on our own in a pool, or how do we go about getting into this aquatic exercise regimen?
Yeah, definitely. That's what we recommend mostly. I feel like most of our patients choose to go that route. Like I have patients that will come to see me even that like come through our MDA clinic and they'll be interested in aquatics, or they're like, I don't even want like a 3-month duration. Like, I just want to learn kind of what I'm supposed to do. So they'll come see me for even like a 1 or 2 time appointment, and we'll get them in the pool. And sometimes I'm not even doing like 8 to 10 reps of every exercise, like, because we want to try as many as we can, but I don't want to overexhaust them in one session. So I'll be like, let's try 3 reps of each exercise so I don't exhaust you, but we're trying as many as we can so I know what works for you. And then I'm making them a home program that's like specialized and individualized for them, and then sending them on their way. And I'll either help them find a place, or they're like, oh, I already have a YMCA down the road, I'm going to go there. Or my sister has a pool, and I'm going to go there. So that's what we do here. Because sometimes people just feel better getting like a program structured to them, and then they take it on their own. So that's like a way that if they don't want to go to physical therapy 1 time a week for like 3 months, but then they still want the instruction from a PT about like what they should actually be doing. That's a good like in between way of learning what to do on your own. So I would definitely like ask, find a PT clinic maybe near your home and see if they do aquatic therapy, and even see like, can I just do like a session or two if you'd rather do it that way, just so you can learn like what to do in the pool on your own.
Andrea, are you working with Dr. Scott Harper or Linda Lowe's?
So I know both of them. They're at Nationwide Children's. So I'm close to Linda. I know her, but yeah, since we're at OSU, we're like mainly with adults. Yeah. Yeah. So yeah. So I work with Dr. Al Sheik.
Their research is not restricted to just children, though, is it, at that clinic?
They do mostly children. I think they do some adults. I know they do some adults, but like we have like an all adult clinic, MDA clinic in our like OSU facility. So yeah, I think we overlap maybe a tiny bit, but
I
yeah,
say that
I know
because,
Linda very well from like clinical trial world and everything. Yeah.
well, that's good because she
Yeah.
was at the biannual conference in Denver
Oh, okay. Yeah,
for
awesome.
FSH. So
Yeah,
I got
that's
to meet
cool.
her there and
Yeah.
performed her what she was trying to do.
Yeah, cool. That's awesome.
I don't recognize anybody here, but everybody's muted and nobody's showing their video. If
Yeah.
they look around on their screen, they can turn on their video and
Yeah.
unmute if they want to. But
Yeah. Yeah.
and you can also do a gallery view where you get to see everybody. So
Yeah.
it's nice being able to see you, Andrea.
Yeah. Yeah. Let's see.
Sorry, Rick, some of us are at work and
Well,
on
I
our
was
lunch
at
break or
lunch.
something, so can't
I saw his
can't
lunch
share.
meal.
Yeah, well, I'm preparing lunch for my kids, so can't really share
Yeah, you're
Molly said
okay.
at work too.
unless you want to see
So
what
that's it.
we're eating for lunch.
I was eating Honduran.
Sounds good.
Korean here. I'm eating Korean.
Very nice.
So,
Anyway, so that might be the reason because we do a wellness hour, and about two-thirds of the people are in the video, so you get to see all the other people,
oh,
which is a nice way to get to know others with FSH. So that's a
right,
nice thing to
right.
be sharing. So,
Yeah, yeah, definitely.
Sylvia
Everyone's
took a
at work
chance
right now. You can always type questions if you
in
can't
the
talk at
chat.
work too. Yeah, you can chat to me if you.
Yeah, there's no Q&A choice. It's just chat.
Yeah, yeah.
Sylvia, where are you?
California.
California, okay, because somebody's from Portugal or Brazil. That's pretty cool.
Oh,
They were
that's
doing the
cool.
closed captioning in Portuguese. That was pretty cool.
Oh, is that what it was? I was
Mhm.
wondering. Yeah, yeah. And too, if anyone thinks of any questions like later on that they're like, oh, I forgot to ask that, you can always, email me or call me. My voice or my phone number will go directly to a voicemail because it's like a Cisco Jabber that's set up through OSU, but it goes to my email and then I just listen to the voicemail and I'll call you back. Oh, Molly wrote in. Oh,
Yeah, that was a big day when they went to Capitol Hill. So
that's
that
awesome.
was great that you were there, Molly.
Yeah, that's really cool.
Well, I've gotten the best benefit from physical therapists over the years. So thank you for what you do. And
Yeah, of
even better when
course.
you have an understanding of FSH, but you do
Yeah.
it for many people with all variations of muscular dystrophy. Is that
Yeah.
correct?
Yes, yes. Yeah, I only see neuromuscular patients. So all different varieties and yeah, types.
So
So
Andrea, I'm in Florida. So
okay.
if for health insurance purposes, if um, have you had anybody from out of state being able to get a insurance cover PT?
Oh, like
Hmm.
back in their home. I have not heard of any. PT is usually pretty widely covered. I think we
Oh
do
no,
a
when the provider is out of state. So say for example,
oh,
I
I
was going to,
see.
yeah,
Yeah, if you want to come here to our clinic, you mean?
yeah.
Yeah, so we do have people from out of state. I think they're a little bit closer in borders. But we do definitely have people from out of state that come to our MDA clinic. So we can definitely check further on that for you. I'm trying to think if we've had anyone from Florida. But we have had people like, like around the bordering states of ours. I will say that if you come to MDA clinic for ours, we're kind of all under a big grant. So you do not have to pay for like PT services. If you're just seeing me for a consult that day. However, because I don't bill that day, we're all lumped under like the doctor's visit. However, if you're going to see me for an aquatic visit, we do bill because that's like a separate day that's not lumped under MDA clinic. So, but yeah, if you are interested in like coming to our MDA clinic, Dr. El Sheikh and like Dr. Isford are one of our main doctors that see our main physicians that see individuals with FSHD. I can definitely get you more information on that. They're like absolutely wonderful. Everyone loves them. So,
When I first got started knowing that I had muscular dystrophy, it was with the MDA, not the FSH Society. And what they offered through the MDA was yearly one visit with the neurologist and at the same time a visit with a physical therapist. That was fantastic. Then they stopped that in
yeah,
Knoxville. So,
yeah,
but that was a great benefit. Now I'm with the FSH Society and involved in a lot of clinical trials where I get a lot of the benefits of
right.
physical therapists and neurologists.
Right, right. Yeah. Yeah, MDA clinic is amazing because we just have so many providers there in clinic. It's kind of like a one-stop shop. You know, you're seeing the physician, and the physician comes back and says, "Oh, I think the patient could benefit from seeing all these different people today." Like we have social work, we have a dietitian, we have PT, we have genetic counseling, we have nurses. So there's just it's just so wonderful.
Well, that's right there at the clinic, but beyond that, the MDA provided gatherings, like once
Right,
a month
right.
or so. So that's,
Yeah.
and Rakesh, you're down in Florida, and you're saying you're not in association with anybody else that has FSH?
Yeah, it's hard to find somebody local here. Yeah, I've tried to even contact the local chapter. Maybe,
Yeah,
it's
there should be a local chapter for you.
hmm,
Where are
yeah,
you at in Florida?
Tampa Bay.
I think there's got to be. Anyway, if you contact June, who was the first person on
Hmm,
this show, she could put you in contact with others
yeah.
in Tampa that
Hmm,
either have a chapter or simply just others with FSH.
yeah, yeah, yeah.
It's
No,
quite
I mean we
rewarding.
do have local MDA clinics around here, but
Not the
um,
same.
yeah, exactly. So that's the reason I was just curious how this like Andrea, how to somebody who specializes in
There is
muscular dystrophy.
I know a couple therapists in Florida that also work with patients with neuromuscular conditions. I am just not as familiar with like where all the locations are in Florida. So I will look at like where the Tampa Bay area is and see if you
Hmm,
are close to them. And then I can always, if someone sends me like your contact information, I can always see how close you are to them. But they're amazing like physical therapists, and they could always you know we could always potentially like help you get set up with something
hmm.
um because I know them from like being in the clinical trial or research world, because we work on like clinical trials for FSHD and other neuromuscular disorders together.
Oh, okay. Yeah,
So,
sure.
yeah, can
Hmm.
see if you're remotely close to them or not.
Yeah, yeah, absolutely.
Yeah, let's see, I think
Well,
there's
I
another.
think you go to 1 o'clock. I think you can go
Yeah.
off and people have
Hmm.
to leave their lunch
Oh,
hour.
you're fine. I
Yeah.
was looking at one of the other messages here. I've been told to look at
Did
this.
you share your contact on the
I
chat or?
did. It's one of I can bring it up again here. I was just looking at this other chat.
Well, it
Yeah,
was
I
a
can take a
slide.
screen.
If you can put it into the
Yeah, it
chat.
was a slide. Yeah, I can take a screenshot if you bring the slide up.
Yeah,
Sorry.
me. No, you're good. Can you see? No, I stopped sharing. Let me bring it back up again. Okay, can you guys see that? Do you want me to make it
Very
big?
good. Yes, that's
Okay,
Yeah.
it.
Hmm.
there you go.
All right. Awesome. Thank you.
Yeah. So if you would like to reach out to me, or I know you were in the Tampa Bay area, and then I can reach out to that other therapist and just see
Hmm.
how close he is to you, if you would like me to do that.
Yeah, please. Yeah,
Okay,
awesome. Yeah, I'll
perfect.
just write you an email then.
Yeah, perfect. Sounds good.
Okay. Thanks, Andrew.
Yeah, no problem.
Well, thank you so much. I'm going to take off,
Yeah.
and I imagine you can be released by yourself.
Yes.
June's not here to say the
Yeah.
session's over. So
Yeah,
it was
awesome.
recording. So thank you
Yeah.
so much.
Yeah, thank you for all your help. Take care.
Bye-bye.
Thank
Bye.
you. Bye-bye.
Yeah, thank
Bye,
you.
Rakesh.
Bye.
Bye-bye.